Good morning. This meeting of the Health, Environment, and Technology Committee is now called to order. I'm Danielle McCray, representing the 2nd District as Councilwoman and also the Chair of Committee. In attendance, we have Councilman Mark Conway from the 4th District, and also Councilwoman Felicia Porter from the 10th District. From the Mayor's Office, we have Sophia Gebran-Hewitt and Nina Themelis.
Thank you, Madam Chair.
And from the Council President's Office, we have Preston Lewis. Also in attendance, we have Matthew Peters, staff to the committee. Before we get started, please take a moment to turn off or silence your cell phone. Also, if you have joined us in the council chamber and you would like to testify, there is a sign-in sheet just outside the door. Please sign in and check the box to indicate that you wish to testify. Today, the committee is hearing Resolution 22-0127R, Informational Hearing 988 Suicide and Crisis Lifeline, for the purpose of inviting representatives from the Baltimore City Health Department, the Baltimore City Fire Department, the Baltimore Police Department, the Department of Finance, the Baltimore City Law Department, and other interested parties to appear before the City Council to discuss the implementation of 988 Suicide and Crisis Lifeline, its anticipated impact on individuals that use this resource, and the implementation plan for Baltimore City. For this hearing, we're going to start with brief opening remarks from myself. Then we're going to hear from agency representatives and have an opportunity for our committee members to ask questions. After that, the public will have a chance to testify on the resolution. In 2020, Congress unanimously passed the National Suicide Hotline Designation Act, which required the Federal Communications Commission to designate 988 as the universal telephone number for the National Suicide Prevention and Mental Health Crisis Hotline. The implementation of 988 meets Baltimore City's eagerness to bolster effective and wide-ranging crisis intervention services. Last June, the 911 Behavioral Health Diversion Pilot Program was launched with the core mission of matching Baltimoreans to the most appropriate and available resources, while also reducing the number of unnecessary police encounters with individuals experiencing a behavioral health crisis. 911 calls are now diverted to 988 through the Here to Help hotline for 3 behavioral health crisis call types. Mayor Scott, along with other elected officials and partners, recently announced that we will be working alongside Baltimore County, Howard County, and Carroll County to regionalize our call centers and ensure everyone receives fast and effective services. Because Baltimore City has already been building out its infrastructure, we have greater knowledge, giving us the boost we need to make this as successful as possible. As co-chair of the Baltimore City Suicide Prevention Legislative Work Group, I have been fortunate enough to work with a determined cohort of subject matter experts who have been engaging in this work for decades and have played a critical role in acquiring the necessary funding and rolling out the comprehensive system. It is imperative, I feel, that this body, along with all city residents, have a clear understanding as to how the 988 Suicide and Crisis Lifeline will be implemented, how it will impact individuals that use this resource, and what it means for the city as a whole. During a crisis, everyone, regardless of identity or zip code, deserves to have someone to call, someone to respond, and somewhere to go if necessary. There has never been a more critical time to expand these resources, reduce our reliance on police responses to behavioral health calls, and eliminate the overburdening of emergency departments and destigmatize behavioral health crises. I look forward to engaging my colleagues, city agencies, and local behavioral health organizations to discuss this critical topic. At this time, we're going to hear from our agency representatives, committee members. Please hold your questions until we've heard from all of the agencies. After we hear from our agencies, we will be having a presentation from BHSB and BCRI to discuss the implementation. At this time, we're going to hear from our health department.
Good morning, Kelly Eastman from the Baltimore City Health Department. We stand by our report and we're happy to answer any questions and look forward to the conversation.
Thank you. And our police department.
Thank you, Madam Chair. I'm Shannon Conway, Legislative Coordinator for BPD. I'm joined by Major Loeffler, who oversees education and training for the department. And we stand by our report and have no objections to the bill, and we're happy to answer any questions that the committee may have.
Thank you. Our Fire Department.
Good morning, Madam Chair, ladies and gentlemen of the City Council. For the record, my name is James Matz. I'm the Deputy Chief of EMS. We stand by our report. We'll be happy to answer any questions that will come up.
Thank you. Department of Finance.
Good morning, Mara James, Assistant Budget Director for BBMR. We stand by our report, here to answer any questions. Thank you.
In our City Solicitor's Office.
Good morning, Elena DePietro from the Baltimore City Law Department. We stand by our report as well, and we're happy to entertain any questions later on in the hearing.
Okay, thank you. We have been joined by Councilman Dorsey as well as Councilman Torrance at this time. We're going to have a presentation from BHSB and BCRI. If you guys could come to the mic and just introduce yourself, first and last name, and also the organization you're representing.
Good afternoon, Madam Chair and members of the committee. I say good afternoon. It is definitely the morning.
I'm just nodding.
It's already been a long morning, you can tell. My name is Stacey Jefferson, and I'm the Director of Policy and Stakeholder Engagement at Behavioral Health System Baltimore. I'm also joined today by my colleagues, Mr. Daniel Rabbit, who is our GBRICS Policy Director at Behavioral Health System Baltimore, as well as Quinita Garrett, who is with Baltimore Crisis Response and serves as the Director of Call Center and System Coordination. And thank you for having us here today. We're excited about the opportunity to talk about Call 988 and the crisis system in Baltimore City. We want to begin briefly by sharing with you our role at BHSB, also as it relates to crisis services. We are the nonprofit organization that serves as the local system manager for mental health and substance use disorder services for Baltimore City. Our mission is to work to develop, implement, and align resources, programs, policies that support behavioral health and wellness of the individuals, families, and communities. Our core functions are advocacy and planning, to manage public funds, to work with local partners, to also do public education, and again, to serve as the system manager. And this next slide just shows briefly where we fall in the context of the behavioral health system. And so as part of that, we do oversee crisis services. There are multiple crisis providers that provide services in Baltimore City. And so we have Baltimore Crisis Response, which we have a representative here who will talk more about their role, but they also, they work on the 988 helpline, the call center. And we also have Catholic Charities, who has Baltimore Child and Adolescent Response. That is the crisis response for children and families. We also have Turk House, which oversees the Stabilization Center, and that is the sobering services for Baltimore City. And then we have Gaudenzia, who also offers walk-in crisis services that is also substance use disorder related. And currently in Baltimore City, the spending for crisis services is around $13 million. This includes grant funding as well as reimbursable funds through Medicaid. And before I turn it over to my colleagues, I just would like to mention that crisis care, we know, is a known effective strategy for suicide prevention. However, we recognize that our current system has been inconsistent and inadequate for years, and mostly due to being under-resourced. Crisis care definitely, as our chair mentioned, it should be valued in the same way we value other emergency response services, like hospitals, fire, and law enforcement. And we have a unique opportunity here in Baltimore with the GBRICS project to expand our crisis services, and also with the implementation of 988. And so I'll turn it over to my colleague, Mr. Daniel Rabbit.
Good morning, council members. My name is Dan Rabbit. I'm a policy director focusing on crisis response services here at Behavioral Health System Baltimore. It's good to be with you. So with the launch of 988, like the councilwoman said, it is a really important moment in how the city provides behavioral health, mental health, and substance use services to its residents. 988, it's more than just a new phone number. It's an opportunity to reimagine the place that mental health and substance use crisis response sits in our system of care. There's been a lot of momentum over the past few years towards providing mental health responses to mental health challenges and trying to reduce our reliance on 911, emergency rooms, and law enforcement for mental health crisis response and substance use crisis response. So 988 gives us this opportunity to take a pause and assess where we're at and recommit ourselves to building out a system that can live in a parallel place to where 911 and our other emergency response services sit, but can provide the same level of dependability and timeliness and responsiveness that 911, law enforcement, and EMS does for the emergencies that they respond to. So like the chairwoman said, like the chairwoman said, 988 launched this year, July 16th specifically, and this is a national initiative, a national effort. The 988 is replacing a 10-digit number, a 10-digit 1-800 number that has served as the suicide prevention lifeline number for 15, 20 years. And so 988 is building off of the network that was already in place to provide crisis response services and supportive counseling to folks who called this previous 10-digit number. Both numbers are still available and will be for the foreseeable future. But nationwide, we're transitioning to focusing on 988 as our go-to number for mental health and substance use crisis response and supportive counseling. There's a lot of advantages to having a 3-digit number. The most obvious one is that it's more easily remembered. And this is the first time in our nation's history that we've had a nationwide 3-digit number for mental health and substance use crisis services. Having that 3-digit number that is similar to 911 kind of puts it on the same level as 911, and we think that that's appropriate. It also gives us this opportunity to invest, to take a moment and think about what investments are needed to really strengthen this system. This is just the latest in a long line of expansions for suicide prevention and mental health crisis. The Lifeline, as we know it today, was established in 2005. BCRI has been a member of that network since that time and has been providing these sorts of services for even longer. Quinita will tell you more about that. But this timeline shows you that just over time, nationwide, we're recognizing how important these services are and what is needed to build out the system that we need to respond to people in distress. Here on the local level, we are also transitioning. Folks may probably know the Here to Help hotline. This was like kind of a rebranding that was done of our crisis line a few years back. And we are transitioning from calling it the Here to Help hotline to calling it the Call 988 helpline. This was the result of a series of market research efforts that we did, funded through BHSB dollars, to think about how best to frame this number as 988 launched. And so this, you're going to see this a lot more as we kind of phase out the Here to Help hotline materials. We didn't want to keep the same logo, the same color scheme. We have the tagline, we're here to help. We hope that there's some continuity so that it doesn't seem like this brand new thing, but this is the direction that we're going in. In the meantime, both numbers, again, will continue to be accessible. So the 5175 number, it will still go to BCRI for quite some time. Some of our initial promotional efforts as the system manager has been establishing this new brand. We've created a new website, standalone website for 988, which is 988helpline.org. We have created a number of new resources that are available. I know we dropped some off here at City Hall, but if anybody's offices would like some of these resources, these postcards, flyers, magnets, pens, things of that sort that have 988 on them with our Baltimore colors, we're happy to share that with you and your offices. We've been going to many community events and briefing community partners, similar to what we're doing here at this briefing. And we've also launched a community ambassador program where we work in a more formal way with partners around the city, just to get the word out that this new number is here. One thing I do want to point out is that 988 is great, but it in and of itself is not going to create a comprehensive behavioral health crisis response system. 988 is a new number. 988 will help us in the move to rebalance who's responding to mental health crises, but we still have work to do to build out the other components of our crisis response system and to seek the investments that are needed to get there. Just to point out, BHSB, we are engaged in working with our state leaders and our federal elected officials as well. And so we have helped to convene a campaign called the Fund Maryland 988 campaign. This campaign is over 70 organizations that are committed to helping to lift up the importance of 988 and seek investments in those services. This past legislative session in Annapolis, we were able to establish a trust fund that can help support 988 services over the years to come. $5 million were allocated in the state budget, and we helped to build support for what the state is now pursuing, which is Medicaid reimbursement for mobile response teams and crisis stabilization centers, which are two other key components to our crisis response system. And we're going to continue to work through this group to make sure that all the 988 Lifeline centers in the Baltimore area have the resources that they need. So that's sort of like a high-level overview of where we're at with 988 and sort of where it's come from. At this point, though, I want to pass it over to Quinita Garrett to provide a more local perspective on how 988 is rolling out.
Good morning. My name is Quinita Garrett, and I'm the Director of Call Center and System Coordination with Baltimore Crisis Response, and I'm going to talk about BCRI's role in 988. BCRI, Baltimore Crisis Response, we have been around since 1992, and we are funded by Behavioral Health System Baltimore. We have also been a Lifeline Center, now 988, for over 15 years, and we are part of the 988 Regional Call Center, which currently serves Baltimore City, Howard, Baltimore, and Carroll County. The goal of 988 has always been to provide timely and effective support for callers in need. This support can include emotional support. It can also include behavioral health support and other needed resources. Call types. We receive several different call types on the line. When a counselor answers the phone, they never really know what type of call they're going to answer. Individuals call who are feeling suicidal and need to talk through those feelings. They also may need to be de-escalated. People who feel homicidal and feel that if they didn't call, they may have acted out on those thoughts. We've had people call who say that they are terminally ill and they are dying and they just want to talk to someone before that happens. We've had people who are feeling overwhelmed about their job, their relationship, their children, or the happenings around the world, such as COVID, the war in Ukraine, political woes, and economic worries. Individuals call for substance use concerns. They've reached their wits' end. We have parents call in reference to their adult children who may have overdosed for the third time, or their young child who was recently introduced to drugs. People call wanting to know how they can support their friends and family members or convince them to receive help. We also have people call for themselves seeking mental health outpatient resources. People call for things such as baby formula, diapers, shelter support, financial assistance, outpatient clinics, and the list goes on. What we receive on the call center mostly is solely people calling for emotional support. People going through a divorce or a breakup. People who can't reach out for mental health support because it's not a norm within their culture. People seeking support due to intimate partner violence or experiencing family issues. We often have parents call that say, I don't know what to do with my children, or I feel like I'm failing as a parent. Parents want to talk through those things, or they may have a child who expressed suicidal thoughts for the first time, and they want to know, how can I talk to my child? What can I say to that child? Adults and children dealing with sexual identity issues, adults and children calling to talk about bullying in the workplace or the school, or even in the home, people dealing with poor self-esteem, work-related issues, and school-related issues, people who have experienced a recent trauma or a trauma in the past that they want to work through. We have individuals calling who are panicked and want to work through an anxiety attack. Anxiety is one of our most common calls. We've had people call as soon as they've left the doctor's office, and the counselor on that line who picks up is the first person they've told that they've been diagnosed with a terminal illness. People call when they don't have insurance and they're dealing with things such as dental pain, or they have another physical or mental health condition. Mothers call who have just experienced a miscarriage or a stillbirth, and we often have mothers call who have just had babies who are experiencing ups and downs, and they're scared and they don't know what to do. We have widows call on their anniversary to discuss their deceased spouse or parents, or parents who are grieving children. People call solely just to vent about issues that they can't talk to their family members and friends about. Lastly, we have people who call who are connected to services but still reach out because they have someone on the other end who can't see them and they don't feel judged. And we have people who call often as a regular support system for themselves. So what is Lifeline, now 988? 988 provides 24/7 free confidential support for individuals experiencing suicidal or behavioral health crisis. The lines are staffed by crisis counselors who have specialized training in de-escalation, crisis de-escalation, and suicide de-escalation. This is proven to work, as there are numerous studies that show callers report feeling less depressed, less suicidal, less overwhelmed, and more hopeful. The support provided is non-judgmental and often provided by individuals who have used the line or a similar line themselves. Many of the counselors on the line have lived experience. So what can you expect when you call 988? You'll hear a message that will tell you that you have reached 988. You'll be placed on a brief hold, and then there will be a prompt asking if you're a veteran or if you prefer Spanish. After you select that prompt, you'll be connected to your local center, and if you don't have a local center in your area, you'll be connected to a backup center. 988 is staffed by local crisis centers, so when you dial 988 and you're in Baltimore, you will come to BCRI. The counselors will listen, they will ask questions, and they will assess for safety, and then they will provide support. The counselor may ask some callers what type of support they are seeking. Many people who call for supportive counseling, they don't want the same type of support. Some people only want the counselor to listen, others want advice, while some only want resources to assist with that support. All counselors, they aim to de-escalate a suicidal and a homicidal caller, and they provide follow-up support afterwards. So how did we prepare for 988? We knew that the number would be easy to dial and to remember, which would possibly increase call volume. We prepared for this possible increase by adding additional staff. We're still continuing to add additional staff. We also added additional staff with lived experience. We're currently working on a staffing hybrid model that includes both remote and in-person workers, just so we can present to a broader job market. We also started to have on-call workers and added additional supervisors as well. We also are prepared by increasing our trainings and adding additional trainings to include both online and in-person modules. And we added workshops to assist the counselors with burnout. Lastly, we took a deep dive into our resources to verify that the agencies were still open and that they still provided the resources that they previously provided. So since the launch of 988 in July, there has been an overall increase in calls across the nation. However, BCRI, we only saw a slight increase in calls, both on 988 and both on our local number. We do expect as marketing increases, people are educated about 988, the calls to that line will increase. We're hoping in the future that all of our calls will come through 988, but in the meantime, we're still operating our local 410 number. We're still encouraging hospitals and police to dial our local number so that they can easily reach us. For us, hiring continues to be a challenge. However, on the bright side, we have received additional funding to support our efforts in recruiting, hiring, training, and other needed resources. We're planning community outreaches. People still don't know about 988, so in collaboration with BHSB, we plan to provide several outreaches to spread the word. People are still hesitant to call 988, so it's important to us to not just provide outreach on a one-time basis, but to be present within the community. And lastly, we have seen an increase in first-time callers who want to know how 988 can be used in their business, their counseling centers, their schools, and their outpatient clinics. And people who just want to know, if I dial 988, can you support myself or can you support my loved one? Thank you.
Okay, thank you, Ms. Garrett, and likely Ms. Jefferson and Mr. Rabbit. We're going to start with questions. Some of my questions do have to go directly to you guys. And Ms. Garrett, and if you could just step to the mic, and then we're going to move on to our agencies as well. So Ms. Garrett, you did state, and Ms. Jefferson or Mr. Rabbit, you may need to step in as well if necessary, within your presentation about the outreach, the several outreach items that you have. And in May, NAMI, they had a poll that found that 77% of adults had still never heard of 988, and that the percentage was virtually unchanged in a previous poll. To your knowledge, how does Baltimore's residents' awareness of 988 compare to other areas?
From my knowledge, I know that other areas had a huge campaign, such as on the radio, on TV. They had several ads. For Baltimore City, it's mainly through word of mouth, through websites, through people calling and finding out about it. I know for us, we haven't really started our 988 campaign, and Mr. Rabbit can talk more about that as to why we haven't started our 988 campaign. And I think that's why most people don't know about it, because we really haven't started our 988 campaign.
Okay. Can you walk us through, you did speak about the several outreach programs. Can you walk us through what it looks like, the community outreach, the communication strategies on how we're going to be educating residents on the Lifeline and its purpose? And Mr. Rabbit, if you wanted to also add to that.
Yes. So in collaboration with BHSB, we are going to do several outreaches. We have kind of started that by reaching out to community agencies. Myself and our CEO has started that. We've gone to in-person to several community agencies to let them know about 988. We've sent our 988 toolkits to several people. And it's still a campaign going on that BHSB is a part of and implementing.
Yeah, so promoting the new number is a big priority of BHSB's. In the run-up to the launch, we did this whole market research campaign and established the new website and the logo. And our strategy in these first, it only launched 2.5 months ago. So our strategy in these early months was to work through partners as opposed to doing media buys. We wanted to make sure that the system is managed by Vibrant Emotional Health, which is a national organization. We want to make sure that system was working properly before we devoted a lot of our resources and launched a larger campaign. So what we've done so far, we have some search engine marketing. So if you type in 988, you'll get directed to our website. We have a series of social media content that we and our partners have been posting. We have distributed tens of thousands of postcards and flyers and fact sheets at events, but it's been very word of mouth. Looking to 2023 is when we're going to start doing more out-of-home placement ads like bus stops or billboards, as well as radio ads and a more kind of full court press sort of a campaign, but we wanted just to ramp up slowly just so that we could see how things were playing out and see what kind of increase in call volume we came. Like, and in some places they saw call volume increase a third, like 33% or more. And we weren't sure if Baltimore was going to see that or not, so we didn't want to promote it too much until we sort of got a sense of the call volume and the performance of the routing system.
Could you speak to us more, give us more information about the 988 Community Ambassadors Program?
Sure. So BHSB, and part of our crisis response investments and system change, like you guys may have heard of the GBRICS partnership, as part of that, we have established a community engagement committee that's been meeting for a year and a half or so. And that committee has helped us to identify potential community ambassadors. Those community ambassadors, some are representatives from the school system, some are representatives from neighborhood associations, some are faith-based representatives, like barbers, members of specific ethnic groups like the Latino community or certain refugee communities. And so it's kind of through word of mouth, we've tried to connect with community leaders who are interested in helping to get the word out around 988. And so we've been working closely with them to give them extra support, extra training, and make sure that they have materials to pass out to their community networks. And so that's been ongoing for the last couple months. And I know our ambassadors have been out at as many like in-person events as we can find, as that's sort of ramped up this year.
I can give quickly some examples of events and things that we've also done, because we also have a community engagement coordinator that works with Baltimore City, as well as a community education coordinator. So we've done events like the AFRAM. We've gone to even smaller community fairs and festivals as well to give out information. One of the things to also mention about our ambassador program is we use trusted leaders in the community. And so we've really been working with them to get out the information as well, because one thing we know is that people need to trust that they can call this number. So even as many media buys and things that we do, people need to know that when they call, they are going to get assistance and help. So that is also one of the things this overall at BHSB that we have been doing through our community engagement work, is to really build trust in the community and give out the materials at as many events as we attend through that as well.
Okay, and I just have one more question before I move on to my colleagues. At Monday's GBRICS quarterly forum, presenters highlighted behavioral health workforce challenges, with one being difficulty recruiting and retaining employees. And Ms. Garrett, you did speak about some options that you guys are going to be exploring to make sure that you're recruiting. For both organizations, have you been able to work with MOAD or other city agencies to amplify job opportunities and boost their recruitment efforts?
We've been working with agencies such as Beam to try to recruit for Spanish-speaking individuals. We've also reached out to iHeartRadio to try to recruit nationally. We are working with our accreditation body, American Association of Suicidology, to also recruit. Our regular recruiting efforts, such as posting on job boards, Indeed, we go to college fairs and things like that. It really hasn't been working, so we're trying to reach a broader audience. So we have kind of reached outside of our normal box to try to work on different recruitment efforts.
And have you guys had conversations with the Mayor's Office of Employment Development about job recruitment?
I'm not sure if we have.
Okay.
Yeah, I'm not sure that we have either, but I think that's a great idea, and we'd be happy to connect after this committee to see how we can do that.
Okay, and Nina and Sophie, I know that we did not invite the Mayor's Office of Employment Development, but can we just make sure that, hey, we have opportunities, we have partners who have jobs that are available for our citizens, if we can just get an update on that or see what the connection is, or just make sure that something takes place between these partners. Committee members, Councilwoman Porter.
Thank you, Madam Chair. I noticed from the presentation that you rely heavily on external agencies to support your operations. How would an agency begin to contract with you all to help kind of expand you all's operations, or at least help out with the burden that you all are receiving now?
Yeah, so the Lifeline itself, 988, you have to go through an accrediting process, and the company I mentioned before, Vibrant Emotional Health, is the national body that does that, and BCRI is like the Lifeline provider for that. As part of our other crisis services investments, BHSB has issued a number of competitive procurements. One is to expand mobile crisis teams, mobile response teams, and BCRI and one other organization received contracts through that process. And then there's another aspect of our crisis services investments, which is to work with community clinics to help them, to support them in providing like urgent care and same day, next day appointments. And so I think we've contracted with 18 organizations through that process. But competitive procurements is usually how we want to be good stewards of funds. So we have a mailing list where we publish whenever there's opportunities, and we'd be happy to make sure that you have access to that.
Sure, that would be great. I was more focused on, ma'am, you had mentioned like diapers, you had mentioned other resources, so that's what I'm referring to. But thank you for we still welcome that information.
So we're currently partnered with Healthcare Access Maryland, and when someone calls for an outpatient resource, such as outpatient mental health or substance use services, we can do a direct connection to them, and they can make an appointment for that person. We're also a part of the 211 Press 1 Center, so if someone calls for like formula or diapers, we do a direct warm transfer to 211, explain the situation, and pass that off to them. We also have several other partnerships with agencies such as Turk House. So if someone needs like stabilization, we can connect them to Turk House or contact Turk House so they can explain that support. We reach out to all of our resources when someone needs a resource that we can't provide.
Okay. And I'm wondering, do you have any connection with the Mayor's Office of Children and Family?
We don't, no.
Because I'm wondering if some of these, in addition with 211, information can be received at like CAP centers or different things like that. So really utilizing city agencies to kind of support what you're doing as well.
Yes, and we would love those resources so we could connect.
Thank you, Madam Chair.
Thank you. Councilman Torrance?
Thank you, Madam Chair. My question is more related to our own apparatus for fire and safety. One is, when we eventually have access to do text messaging, especially for those of us who are deaf and hard of hearing, who have hearing disabilities, especially for 988, but also for general 911 purposes, because I know that we haven't activated that portion yet. So I'm just wondering, eventually will we get there? Because I think that that's a barrier that we have not addressed yet, especially with persons with disabilities.
So I can say for us, we just contracted with HASA, who's going to provide interpreting services for us. So for our call center, we'll have video interpreting services, and for our mobile crisis team, we'll be able to dispatch someone to provide ASL services for the deaf and hard of hearing community as well.
Yes, also as far as 911, we did activate text to 911. It's been activated since August of 2020. It was a statewide launch of text to 911. And actually, if I'm not mistaken, the mayor did a press conference around that time when it came out. And we do have the capability of taking 911 calls for the hearing impaired community, as well as if they was to call 911 and they actually needed it, we do have a TTY machine embedded in our 911 system that will also reach out to them. So we do have multiple ways of reaching out to the deaf community.
Can we advertise that more? Because just a cursory review of your actual website is not present.
You said on the?
on your website. Fire's website is not there. Or
Okay,
911.
no problem. But yes, 911 does do text to 911, and actually we do have the ability to text in multi-languages. It's like up to 168 languages. So we do have one technology where if you was to text us in your native language, it will translate back to us in English, and we would text back in English, and it would translate back to you in your native language. So it's no way we cannot miss a 911 call if it's a language barrier, because we do have multiple options to reach different people.
Thank you.
You're welcome.
Councilman Conway?
Thank you, Madam Chair. I've just got two quick questions. First is regarding, it was really interesting, and thank you for the presentation. I was really curious about instances where individuals are homicidal and how we manage that in partnership with our BPD. I've had an instance very recently, just in the last 2 weeks, that we are dealing with on and off, and I'm really curious how we manage those, how it comes through the hotline, how we coordinate with either 911 or directly with the police department, how we think about that. Thanks.
Most individuals who call into the call center in a homicidal, they're able to be de-escalated, and we do a ton of follow-up. If they do mention a person who they're homicidal towards, we have to do an additional assessment. We also have to do a duty to warn that person, you know, this person has expressed this. If we feel that they are unable to be de-escalated, we do reach out to 911. They're really helpful because they'll trace a phone number and they'll send police out. Most people actually say send police because they don't want to do something. So we'll coordinate. Most of the time we'll have the person on the line and police will go. But I would say at least 70% of the time we're able to de-escalate that caller. And we do a ton of follow-up for that caller within a certain time period.
And so these are instances where the subject calls on their own behalf, saying they're
Yes.
having homicidal thoughts. And what about in instances where someone calls on behalf of a subject? Do we have some other, like, is it handled the same way, or?
So if someone calls and say that someone is homicidal or they've made a plan, we had a recent one where someone said someone made a plan to blow up a building. We had to call 911 for that and provide just as much information as we had, and that's what we did for that situation. And then we did follow up for that person as well, just to get additional details. But
Okay, I appreciate that. I just want to make sure that, I think it gets a little sticky there because of course there's a urgency and time sensitivity to those issues, and we certainly don't want to miss that. The other one was, my other question is regarding substance use. You know, I think we are all familiar with folks who may have been using and are in the streets, and I'm sure you guys get calls about those. How do we deal with them? Do we connect them to services to hopefully help them recover, or how's that sort of?
yes, so mostly everyone who calls for themselves, we can connect to a service. We have in-house services that we can connect to, and we also have community partners that we can connect to as well. We do receive a ton of family members that call concerned about their relative, and what we do with that is we provide resources and support to that family member. More often than not, the family member's not ready to receive help, so oftentimes we can't force them to do that, but we do a ton of outreaches, follow-ups. So that family member, you know, hey, we're still here. If you do decide today that you want to get help, call this number, and we're reaching out to the family member that called in reference to that person as well. So it's really just about providing resources and support to that family member or friend that's calling.
And I think with my question, I was thinking of very particular instances that are not uncommon. You may find someone on a street barely hanging on, and let's say I were to call on that person's behalf. Is that something that you guys are able to handle, and how? I mean.
So if someone calls and they say, I see someone on the street, and it could be drug related, we would call and request EMS because we don't know if they're overdosing or if it's just a medical emergency or not. So we would call and request EMS for that situation.
Okay, thank you.
So this gets away from diversion and 988, and Ben Lawner, for the record, Medical Director for Baltimore City Fire Department. And let me first say this is an exceedingly complex discussion. I appreciate all these discussions because at the end of the day, we want to connect people with the right resource. So if 988 is called, the behavioral health apparatus, I would argue, is much more prepared for nuanced discussion. When 911 is called, especially for a second party, Our colleagues in 911 who are receiving over 1,000, who knows, calls per day, and you have 90 seconds to make a decision, that is a very different situation. So I want to emphasize that when we're talking about resources for behavioral health, you're absolutely right. We have calls for social determinants of health, substance use. We have calls for homelessness, homicidality. 988 can sort that out. I think the 911 aspect, which I'm sure we'll talk about a little bit later, how does 911 interface? That's where we have a lot of opportunities. But to answer your specific question, if it is a second or third party call for somebody who may be experiencing substance use associated delirium in the middle of the street, that is a very difficult call to immediately de-escalate to a 988. That's not to say it cannot happen. It just reflects the different pathways in the city that currently exist to get people help.
Got it. So in an instance like that, we should absolutely call 911.
Yes, but what is interesting about that is, and I, believe me, as an emergency physician as well, we don't get commission for how many people come to the ER, and we always want to reduce the burden of patients that come to the emergency department. I will say again, this is part of a larger discussion that 988 would love to be an immediate response paradigm. So whether it is a second party, whether it is a third party, we have the ability to engage callers from all walks of life and backgrounds. Right now, that is a little bit challenging. But as Quinita mentioned, we work very closely with our colleagues, so it's not exclusive. So if 911 gets it and it's more appropriate, we have mechanisms to put it over to 988 for the immediate responses of undifferentiated crisis, where there's an immediate threat to life. Those calls will typically proceed down a 911 pathway.
Thank you. Thanks for clarifying.
Thank you.
Thank you, Madam Chair.
Councilman Dorsey?
Thank you. I'm trying to kind of compose my thoughts a little bit. This is like let's say deeply personal for me. And so I do also want to just first acknowledge and thank the chair for her leadership on this issue. I think for me, it's so personal. It's something I have a hard time taking leadership on. I've had I had a family member jump off the Golden Gate Bridge about 7 years ago, I think, and continue to have friends who I knew prior to me getting sober almost 20 years ago, and other friends who I've known in sobriety who continue to die every year, every few months, really. And I have my own, and a lot of that is kind of untreated alcoholism, untreated addiction that manifests in lots of different ways. And a lot of it's also suicide by subtle means. I feel like there's a real relevance one particular experience of my own that I just like to share. In the months, so I've been sober since March of 2003. I was a regular drug user. I was a late stage alcoholic, kind of at death's doorstep at 20 years old, 21 years old. And a couple of months before I got sober, there was this one incident that comes to mind every once in a while where something clicked in me. Look, I think that if 1% of people ever call 988 who would benefit from it, I think if 1% of those who would benefit ever call it, it's worth having there. There's no question in my mind about that. I don't know that my cousin would have ever called such a thing, but I'm thankful that San Francisco, as of just a few months ago, also has a 988 that he could have had the option to call. I actually did call 911 in a moment of crisis many years ago, 20 years ago, where I was not suicidal. I just knew that something had changed in me, that there had been this shift where something was really, really wrong with me, and I needed help. I'm not by nature a violent person, but I found myself in a moment where I was at the precipice of extreme violence against a close friend. And so I called 911 because I knew that that meant there was something deeply, deeply wrong in me. And I sat on my front steps at 1305 North Calvert Street, waiting for a paddy wagon, because that's the only thing that was available to me at the time, was I could choose to talk to the couple of cops who responded, who had no training at all in how to deal with this. And the best that they could offer was for me to get into the back of the paddy wagon that's used to transport criminals or suspects to Maryland General Hospital, where I sat for 6 hours in the triage room waiting for anybody to care at all. I eventually called my father after sleeping in that triage room for a couple of hours, and he came and picked me up at 4 o'clock in the morning. And I just want to help. I mean, I want to know what somebody in my circumstance would experience differently when they call 988.
So if you call 988 and you're in that type of crisis, the counselor would talk to you. They would try to de-escalate the situation. They would ask you a ton of questions about what got you to this point. If the issue was substance use, they would ask you if you wanted to get into treatment or get help. Depending on your answer, it could go 2 ways. If you said yes, we would do a referral for you. We would do a safety check. We would make sure you were safe that day. We would also make sure you weren't in any you didn't have any immediate medical needs. If you said no, we will offer our mobile team to you to see if you were interested in having a therapist and a nurse come out, which is now. Soon we'll have a peer and a therapist that can respond. And then we would have sent them out to you if you were open to that. We probably would have tried to talk to you over the phone to de-escalate the situation. It doesn't sound like you were like a danger to yourself or anyone. It just sounds like you were trying to reach out for help. So most of the time the counselor's going to talk to you. They're going to offer several different resources. The last resource they would have offered was probably going to be the mobile crisis team, to see if you were interested in that.
Thank you. Appreciate it.
Mm-hmm.
Thank you, Councilman
Thank you, Madam
Dorsey.
Chair. Allow me to share my experience.
Thank you for sharing your story. We greatly appreciate it. I'm glad that this resource is here now. Thank you, Ms. Garrett. Thank you, Mr. Rabbit, and also Ms. Jefferson as well for joining in for your presentation and bringing this to the council and to the public. At this time, I'm going to move to our health department and our other city agencies. For our health department, I just want to know, you did highlight a few items within the report. I want to know, what does collaboration, if any, looks like with BHSB and also BCRI, and how you guys are communicating now that 988 is available to the public.
Great. Hello. Kelly Eastman again from the Health Department. So thank you for the question. So we've been promoting the 988 number. So generally we do this on our website. And when the new number came out, we updated all the materials when that happened. We've also shared it out via email blast with all of our staff to make sure that they have the updated information, and then share that with their partner organizations and the residents that they interact with. More specifically, many of our programs use the number to connect people or give that out to people. So some of those examples are our healthcare on the spot van and our sexual health clinics. They connect people with the number, or they offer the number to the clients who they think might be at risk during their visit. Additionally, our overdose program promotes the 988 number, as well as all the contracted vendors that work through them. And additionally, whenever there's a pain clinic or CDS closure, we refer people to 988 as a resource if they need assistance finding a new provider. And then our syringe services program promotes the resources on their van as well. within our aging division, we refer older adults to the crisis center for support, and we also have staff that sit on the 911 behavioral health diversion project calls every week. And then lastly, one more thing just want to note is that we are in the process of hiring that suicide prevention coordinator as a part of legislation last year, and look to begin that interview process. So that's really our role in promoting the number. Those are some examples.
Thank you. For our emergency service providers, have we noticed any significant call change or even a slight change within call volume for behavioral health crises since the June 22 rollout?
Good morning, Madam Chairman. For the police department, and I'm Major Derek Loeffler, the Commander of Education and Training. Since the second half of last year, really with the implementation of the 911 diversion program and in the increase in the awareness, especially in the officer side as well, we've seen BPD-related behavioral health calls decrease since the halfway point of last year. And BCRI, as a result, has seen an increase in their related types of calls too since that time frame. So for our perspective, the calls have been decreasing and being handled in an alternative way.
Okay, and then for our fire department, have you guys noticed any type of decrease in your call volume or calls for service regarding that issue?
Okay, first let me start by saying I do apologize for not introducing myself earlier. My name is Tania Reddick. I am the 911 director for Baltimore City. Since June of 2021, when we actually started the BCRI health diversion program, it has been an increase as far as the calls that are dialed into 911. And I would say it's more of an increase because now we're tracking them. We're actually doing the hard data on them to know what we need in order for the people of the city to get the right resources that they need. So now that we notice that it is an increase in calls, what we do with the 911 diversion program is we use one of our emergency dispatch protocols where we actually interview the callers, and based off the questions that that's given and the answers that they give to us, then we know if it needs to be diverted to the 988, or do we actually need to send EMS or police. Based off of that, as of today, we had some data that is public record, is on the city website. We've had 3,586 calls that was involving 988. As of right now, 2,474 of them included co-responses, meaning fire department responding as well as police, and 789 of the BCRI incidents they were actually BCRI incidents. So as you can see, it is a lot of calls that do come into 911 for these type of calls for people that's experiencing substance abuse or behavioral crisis.
And Madam Chair, I would just go a step further. When this program was rolled out last year, it's a very slow process. We get a lot of different call determinants. We have to make sure the right person gets the right resource. So from that, they actually meet weekly and evaluate their responses. They look for their successes and failures or weaknesses and where they can correct those. I think you're up to, Dr. Lorna, was it 3 determinants or 4 determinants using that?
We're currently up to 3 determinants.
That they automatically shuffle right
that
over.
We automatically actually transfer to BCRI. And I can give you just a small, it's right now it's non-suicidal and they are alert. And it's suicidal and alert, and someone's just threatening suicide, as long as that person has not taken anything or do not have any weapons present. These are the calls that we currently transfer over to 988. And it has to be first party, and so it has to be the caller themselves or second party with the first party actually present. So, and that's so they can talk to the counselor with the person present or get the information that they need.
So this is also, as you're hearing, it's not a simple answer. I would argue that I think we see this all the time. When we first published on this, this was way before there was any behavioral health apparatus. Substance use and behavioral health complicates about, depending upon how you define it, 50 to 60% of all 911 calls into Baltimore City. Now, I would argue that this burden is not going to decrease anytime soon. I would also say that it's very important to recognize that the 911 determinants are not a good way to determine whether or not the system is being utilized, because the 911 determinants are basically designed to figure out whether somebody is experiencing an immediate life threat or not. They're rather binary. So the metrics that I think are very important are the ones that Director Reddick highlighted, meaning that we want to be there. This is why I think the whole discussion of diversion is somewhat difficult. We don't want to divert calls. We want to be able to deal with all of the calls. We want to be able to deal with the calls in the correct way. So I think a measure of this program, particular program success, is how many calls that come into 911 that are effectively mitigated either through co-notification, where we talk to our colleagues, or a reduction in police response, or a reduction in EMS response, because the burden of behavioral health crisis, as we heard, it's going to continue to be here for a while, and pardon me, I don't think it's going to go away anytime soon. The real charge from the 911 agencies, such as ours, fire, police, and EMS, is to make sure we deal with the call with the severity, the consideration, and the nuance that's required.
So just as a follow-up, since we're talking about the diversion program, according to the 911 Behavioral Health Diversion Program, the dashboard, as of September 19th, there were 382 attempted diversions to the 988 hotline, in which 42%, 181 of the diversions were returned to 911. 221, 56% diversions were resolved by 988 only, and there were 38 callers that declined to speak with the 988 helpline. Did we have any information as to what the reason it may have been for declining the 988 option? And if, I don't know if you guys can weigh in on that, but did we have any reasons for the few who actually declined the service to 988?
How you doing? My name is Wayne Harris. I'm Baltimore City 911 Operations Manager. There's not a particular reason that a person doesn't necessarily want to speak with a 988 counselor. More or less, if a person calls in and they're divertible, and we attempt to divert them, and they either hang up or they decline. Actually, when we get the counselor on the phone, I don't want to speak to them. I want a police officer. So at that point, we'll likely put the call in, put it back in for police-only response or EMS-only response. With the police response, we let them know that we need a CIT officer, and typically, if we have one available, they'll go out. Noting that in the text of the call, they also go out with a different mindset. So they know they're not going out necessarily for a crime or a person that's committing a crime or a person that's injured or anything like that. They approach it with a soft hand, so to speak, and that's how we handle it now.
I would agree. We are also seeing with our homeless population, a lot of them just quite simply want shelter. And it's so some people, when they call, they want to go to the hospital, which is, I think, a very common response that we get in 911. So the callers also that have contact with BCRI, we do with a certain population that there's a high degree of recidivism. And so they have already experienced the issue of, do you want to talk to somebody? And quite honestly, there is an amount of secondary gain where people want other resources apart from counseling. That's why I would argue that the 911 conversation is very difficult and complicated, because it's sometimes very challenging to figure out what people need. It's always much better to do it on the front end. If you link somebody with if you link a patient in need with a mental health counselor and the patient is motivated and it's first party, we can have that conversation. By the time the call comes to 911, because if you're homeless or if you're using substances or if you need to go to the hospital, it's very difficult to divert that type of patient. And I think we are working very diligently to develop some more protocols and nuances so that we can figure out, number one, what these callers need and make sure we have the appropriate response to them. But to answer your question very specifically, we see it a lot. They have already been contacted with BCRI. They either want shelter or they want a police response, or they're not interested in further conversation. They've already been through that system before. I don't know that that is a failure of the program. It just, again, means to me that 911 needs to develop into a very all-hazards situation, a very all-hazards sort of answering public safety point, where we can get a nuanced information or a better information of what the callers need and then direct them accordingly according to the resources that we have.
Right, and just to coincide with what Dr. Lorna said, you have to think about it. When people think of 911, it's an emergency situation. And the only thing they really think about when they're dialing 911 is police or paramedic or fire department. So what we're trying to do with the 911 behavioral diversion is change the mindset. It's letting them know that it's other resources out here other than what you were trained or what you thought it was. So that those 38 people, it's us changing the mindset of letting them know, hey, look, it is other options out there. And their first thing is, I'm used to police coming out. I'm used to a medic coming out. Or if that's like he said, for a shelter or just for someone to talk to face, we have to let them know through advertisement or other avenues that it is other resources out here that we're able to provide to them other than police or EMS.
Thank you all for your responses. I appreciate it. Committee members, did we have any other questions? Okay. We're going to move on to see if we have any public testimony at this time. Thank you, forgot all about that one. So we don't have anyone in person, so we're gonna move on to public testimony. Members of the public online, if you would like to testify, I'm just asking in your own WebEx that you use the raise hand function to let us know. We're going to monitor it for about 30 seconds to see if anyone wants to testify at this time. Okay, and we do not have any attendees, so that's going to, on the WebEx, who would also like to testify, so that's going to conclude public testimony. I did want to thank the Suicide Legislative Prevention Work Group members for submitting written testimony. I am going to recommend the resolution, make a motion to recommend the resolution favorably. Is there a second? Okay, second, I heard first from Councilman Dorsey. Myself, Danielle McCray, I'm a yes. Bullock is absent. Conway?
Yes.
Dorsey?
Yes.
Porter is absent. Torrance?
Aye.
And Schleifer is absent. So 4-0, this motion has passed. The committee is going to report the resolution at the next City Council meeting. I thank you all for your time and your thoughtful responses and your reports. Have a great day. Bye-bye.